Hi everybody, I'm Lauren and I'm going to be doing my discussion 2 video for nursing 648. So to start, the medication I'm going to be talking about today is albuterol. Albuterol is a medication that is used in people normally with chronic lung disease such as asthma, COPD, things like that. So it's used as a medication, kind of as a rescue. So if someone's having symptoms of unable to breathe, chest tightness, that sort of thing, they would use the albuterol. It opens up the lungs to help breathe. So I'll kind of get into a little bit more specifics with that. So to start, the pharmacodynamics for this medication is that it affects the smooth muscle within the lungs. So with a chronic disease, they can kind of tighten up. And so with this albuterol medication class is a bronchodilator. So with this bronchodilator, it's able to be inhaled and then help to dilate and open up the lungs more, allowing the airflow to increase. Obviously then helping someone to feel better breathing and being able to feel better. So the receptors in the human body that the albuterol affects are called beta-2 receptors. These receptors trigger enzymes in the body that, again, are used to relax the smooth muscle. So again, we're allowing more of that airflow that I kind of mentioned a bit ago. When the beta-2 receptors are triggered by the medication, it's actually more of like an immediate release. But along with that, symptoms could have an increase in heart rate because the broncho-2 and the beta-2 affects more than the kind of the respiratory symptoms, and also can affect the cardiac system as well as the nervous system. So may increase heart rate as well as a person's diastolic blood pressure may decrease, and then also some tremors may develop. Pharmacokinetics of this medication, albuterol is most commonly absorbed via inhalation, like I mentioned, so the inhaler form, as well as could be nebulized and right into the lungs. So what I was researching with this method, obviously with the inhalation or the nebulizer, not all of that medication is going to be getting straight into the lungs. So it actually, I found that only 5% of the inhaled or nebulized albuterol is needed for effects to be seen. So I thought that was pretty neat. There are also oral forms of albuterol. So there's also kind of an immediate release as well as an extended release tablet that can be taken. I think they're not super common, but absorption, the PO stuff is immediately absorbed by the GI tract. After that, the medication enters the bloodstream and then of course is spread throughout the body and tissues to help those beta-2 receptors do what they do and help the lungs and the airflow increase. And then with all bronchodilator medication, which again is the class that albuterol falls under, those are metabolized within the liver and then most likely are excreted through the urine. So with inhaled albuterol, 72% of that is actually excreted in the urine the day of use. And then 10% is excreted via feces. With oral routes of albuterol, it can take around 3 to 4 days for the medication to be excreted with urine and feces, majority in urine. Common adverse effects of albuterol, I kind of touched on this a little bit ago with how the bronchodilators affect the beta-2 receptors affect CNS, cardiac, respiratory, those symptoms. So things, again, you can kind of see are related to those systems. So that would be an increased heart rate, heart palpitations possibly, restlessness, tremors, dizziness, headaches, insomnia, and or actually an increase in cough as well. These symptoms should not be life-threatening. Therefore, if an adverse effect happens, it's not necessarily a cause for a discontinuation of the medication. Kind of the doses might just need to be triggered or titrated a little bit, maybe decreased, just to lessen those symptoms. And then special considerations. With patients that have a history of cardiac arrhythmia, stroke, heart failure, hypertension, coronary insufficiency, may need a lower dose of this medication. And so that normally happens kind of in the elderly, obviously, of course, of a history of heart disease, failure, stroke. You're gonna see that more in the elderly population. So it's really just keep an eye out. We're gonna need low doses for that elderly population. For our diabetic population, we're going to need to teach that this can actually kind of cause a little bit of insulin resistance, so we might need to note that more insulin might be needed when using the albuterol. In children, it's recommended to be used ages 4+, so kind of not in babies, but 4+ up, the administration instructions would actually be the same for an adult. So those would be kind of 2 puffs as needed every 4 to 6 hours per day. And then also if a child had, chronic asthma, something like that, if they needed the nebulizer treatments, those dosages can be calculated on weight. So I think that's kind of all I have for this albuterol teaching. Just reply to my post if you guys have any questions. Thank you so much.